education and community service for Pennsylvania medical students. So we're fairly new this year, and we have some big plans to hopefully bring people community service events and educational events going forward. And we have leadership opportunities for students from every medical school in Pennsylvania. So stay tuned for things that will be coming from us in the future. So about today, what we're going to do is we have an awesome panel. We have Dr. Quinn, who's the current PACEP president. We have Dr. Lauber, who's a former PACEP board member and a current EMRA board member. And we have a really awesome dynamic group of your colleagues who have been doing a lot of different things with regards to the coronavirus pandemic. And so we're going to offer the opportunity for everybody to introduce themselves, a little bit of what they've been doing, so you have a frame of reference similar to the sheet we sent out earlier. And then we're going to open it up to the group to just ask questions and figure out how they can get involved in different opportunities for, being a valuable part of the medical community right now. So just to introduce myself a little bit, what I've been up to in the past couple of weeks. Before medical school, I was a paramedic. And so I've been doing that for the few weeks in Montgomery County and Delaware County, Pennsylvania, which we are starting to really ramp up in cases right now. So we're kind of in the thick of things. And so I'm happy to talk about emergency medical services, what we're up to, and what we are going to need in the future. So with that, I will turn it over to Dr. Quinn.
Thanks, Alex. Sean Quinn. I work in Allentown at Lehigh Valley Health Network. As Alex said, I'm the current PACEP president. I am also the APD of the residency at Lehigh Valley, so I can speak to kind of what we're doing with our residents. And the good thing is Priya is also one of our residents, so she can kind of talk from her end of things of what we're doing with the residency. I'm also pretty involved from the network level as to what we're doing in terms of surge planning and things along those lines. So I can speak to kind of how we've rearranged our emergency department and how the network's planning to handle the peak, which we're theoretically expecting around April the 17th or 18th at this point. So I can also speak to anything else you guys would like in terms of policy that's going on right now and kind of what national ACEP is doing as well. But I just wanted to say thanks to Alex and Katie and Brendan. You guys have been doing a great job. I know this is a very primordial part of the Medical Student Council, but I think we're looking forward to some great things from the medical students in the state. So thanks so much.
Dr. Lauber.
Hi, everyone. My name is Priyanka Lauber. I'm a PGY3 at Lehigh Valley, same hospital system as Dr. Quinn. I'm also a former PACEP board member and current EMRA member. I just wanted to thank everyone first for tuning in. I wanted to provide a little bit of information from the PACEP and EMRA side, and also kind of give a quick resident perspective. So I mean, not to toot our own horn, but Lehigh has done wonderful in terms of protecting residents and looking out for residents' well-being. One of the things I also wanted to learn from you guys is also how to get our students involved, because I don't think at this point we're utilizing our students in the community as well as we would like. So this is both a learning opportunity for me, and I'm happy to share the experiences I've had as well. If you guys are interested in getting more involved, I would suggest also going to EMRA website and going to the committees. All you'd have to do is pick a committee that you would like. Let's just say admin and ops is something you're interested in. Go ahead and put your email in there, and you can get information pretty regularly. Once a month, we have Google Hangouts, places where you can get connected. We often have CEOs, CMOs join us on these calls. So there's a lot of ways to get connected and get networking opportunities. So that's my quick plug on EMRA. And I'm super happy for PACEP for putting together the Medical Student Council. And I'm looking forward to seeing how you guys are going to grow. You're going to do awesome.
Awesome. Jeff?
How you guys doing? My name is Jeff Kelzinski. I'm a third year at PCOM. I'm the PACEP MSC Health Policy and Advocacy Coordinator. And a lot like Alex, I'm also EMT. I worked before med school. And during this whole thing, it's given me time off to, continue working as an EMT. I'm volunteering down the shore in New Jersey, and I've also worked down in Wilmington, Delaware. So both of them have been hit pretty hard. And I've actually been charged with trying to find some people certified in the EMS fields who are willing to volunteer. So if anyone's got certifications active, you can contact me on the outside. Thanks.
Awesome, thank you. Shane?
Oh, there we are. Sorry for the lighting. Hi guys, my name is Shane Brown. I'm a second year at PCOM. I'm also the MSC liaison. So I've been working over the past 2 weeks, like 3 shifts a day with the Philadelphia Medical Reserve Corps, which is a group of volunteers who are deployed in natural disasters, certain events in the city that bring in large crowds. And they have training exercises several times a year. You know, I've been working over the past 2 weeks at the testing center for they do the nasal swabs and the PCRs there, and that's been over the last 2 weeks, and I've mostly done like data collection with them. But as far as your background goes, you know, if you're more medically involved, if you have like a medical license or are like an active EMT, you can volunteer as a clinical helper as well. Yeah, there's several different opportunities right now. They have different events, like they're working down at the Liacourse Center. They're starting to help set that up to become a field hospital. So I'll probably be, you know, there over the next week or two. The other one is Glen Mills School, which is like a non-COVID center for like overflow patients from other hospitals. So they're also like setting that up, and you know, there's a lot of opportunities. So if you want to learn more about that, you can ask. Thanks.
Awesome, thank you so much. Matt?
Hey everybody, Matt Christensen. I see a common thread kind of linking a lot of us together. I'm another paramedic turned medical student. I'm currently the student dean of Chicago Medical School. I sit on EMRA's student council with Katie. And Chicago is a pretty unique situation right now. We've got 7 medical schools within like 10 square miles of each other, just the way that Chicago is set up. So we had a bunch of student leaders from around the city kind of realize that we were all building parallel but redundant, like duplicative efforts. So we ended up putting together this kind of ad hoc volunteer organization called COVID Rapid Response Team Chicago, where we kind of integrated all 6 or 7 of our independent student projects into one organization that kind of had a much wider breadth than we could have accomplished individually. So between so there's 11 student leaders that sit on this executive strategy team, and we've recruited, it's pretty wild to think, over 700 volunteers between our 7 medical schools and some of the other health profession schools that we have contacts with, as well as some community organizations that we've had some like professional partnerships with. So we've been able to plug students and some community members into like community outreach efforts, whether it's advocating or running events to promote you know, populations like the incarcerated community, the homeless community, displaced or quarantined high school students that need remote tutoring, some of those community needs. We've been putting together some healthcare worker care packages, you know, to send to the front lines, just to kind of help address some of the human sides of working so many hours and not being able to, you know, just go home and interact with family. And we have a pretty robust PPE allocation and distribution branch as well. So it's been crazy to be a part of and to see how much has been accomplished just in like 2.5 weeks. But it's been a real privilege for me to be a part of.
That's incredible. So Brendan?
It's a tough act to follow. Hi guys, I'm Brendan Michio. I'm a second year medical student at LeCom. I am the EMRA Northeast MSC representative. So I work with Katie and Matt as well. I And just locally around Erie, I partnered up with one of the hospitals by us to kind of form a medical student network that has now expanded to pre-healthcare students, so PAs, nurses, all that kind of good stuff, to just try and get, you know, all of these things that fall by the wayside for doctors and healthcare workers to get done. So getting groceries and, you know, pet care and childcare and things like that. But also getting groceries and things for those who are immunocompromised and elderly in our community, running errands for them and things like that. So yeah, basically I just set up a small group, and slowly it's been growing, and the tasks that we've been handed have been growing slowly but surely. But so far we haven't been hit too hard here, so it's more just preparation work and getting things in place for when the peak does hit. So if you guys want to ask me about, you know, what kind of prep work we've been doing out here, I'd be more than happy to answer any of those questions. But yeah, so that's it all.
Awesome, thank you. We'll hear from Shelby next.
Hi guys, my name is Shelby Wood. I'm a third-year medical student from St. George's University in Grenada, and I'm currently doing my rotations at the Brooklyn Hospital Center here in New York City. I'm sure you guys have seen in the news that Brooklyn is like one of the hardest hit areas in the country right now, so they're really, really struggling at our hospitals. So in order to kind of help with that, me and one of my other student colleagues, who I think is also on this call, Sergio Camba, we've been working on a medical student task force where we kind of pair medical student volunteers who sign up through a Google form that we've been sending out. We pair them with physicians, nurses, other healthcare professionals who need help with things like childcare, grocery shopping, and pet care, since they're pretty overwhelmed and working a lot of extra hours right now. And we also are part of a PPE initiative where we're trying to find sources of PPE to either donate or buy, and we're kind of coordinating with New York AAEM on that one. And other than that, like most of the other panelists, I am a paramedic by training, and I'm currently awaiting an assignment to go work at one of the field hospitals here in New York City that they're constructing. There's a few of them in construction. So I will be going out to do that hopefully this week at some point.
That's awesome. I'm sure we would definitely love to hear about how things are going in New York right now. Gabby.
Hello, everyone. My name's Gabby. I'm a third-year med student, also from PCOM. Unlike most people here, I'm actually applying urologic surgery, but I'm still a huge fan of EMED. So I've co-founded Med Students for Masks, which is an organization that has been collecting donations via Venmo and GoFundMe and PayPal to purchase PPE. So far we've purchased over 7,000, almost 8,095 masks because we have a task force of over 50 medical students, nursing students, law students who have been, working on this 24/7. We've also secured for both paramedics and hospitals these like plastic intubation boxes, since anesthesiologists, and paramedics are, when they're intubating, there's like a lot of particles that can be flying in the air. So we're securing a lot of those boxes. We've secured over 40 so far. And then we've also secured over 86 right now over 130 face shields right now, working on more. We're always looking for more volunteers. And, aside from that, we've also just purchased various PPE, like disposable scrubs, and things like that. So if anybody wants to get involved, we would be very grateful.
Awesome. And then last but certainly not least, Shannon.
Hi, nice to meet you guys all virtually. I'm a first-year medical student at Boston University. We have a lot of really cool initiatives that have been started up by our students, but probably the biggest one has been our medical personnel support organization. And this has kind of like a two-pronged approach. Like, one is the non-clinical support to physicians, and for that we have about 400 of our medical students who have volunteered to support physicians in this way. And that includes kind of similar to other initiatives I've heard about here, but mainly childcare has been probably the biggest need by frontline health care workers here. And so we've been pairing medical students with medical personnel who are in need of that, but also pharmacy runs, grocery runs, any other remote assistance. And that's kind of open to all preclinical medical students, but also the clinical medical students. And we've even opened up to our PA program and graduate students. We also have sort of a clinical part of volunteering here, and that is only open to M3s and M4s who have ward experience. And there's that is more of a telemedicine type job. And the two kind of things that they're developing are one, a virtual scribing job, and that's so physicians on the wards don't have to worry about writing discharge reports, things like that. And we're modeling that off of a similar model to what they have at, I think, UC Davis. And there's also a telemedicine aspect to that, where volunteers can speak with patients who are concerned about their symptoms, whether, try and advise patients before they head to the hospital. And there's, we've sort of expanded that too. We found that our telehealth, offices that are switching to telehealth are having delays in care where the provider is kind of running late on appointments because they're trying to get patients on the phone, trying to get them comfortable with the telehealth process. So we've had medical students now starting to volunteer to help set up the patients on the call, get them comfortable with what telehealth is, and then bring the provider on the call to kind of decrease that time where the provider is, so the provider can, make their appointments in a timely manner. And then in a separate organization, we also have kind of a need PPE group, which is in close communication with our COVID team at the hospital, trying to raise funds for PPE, calling local organizations for PPE, things like that. So those are kind of the main, I would say, projects we have going on here.
Awesome. This is a really, really dynamic group. So now we're going to open it up to questions and let us know what you guys want to hear about. As we discussed in the email, just use the chat box and then we can read out your questions and people can address them. So anybody has a question, now would be the time. And so in the absence of, like what you guys are thinking, question for our physicians. What do you guys feel like is the major resource you need in the hospitals right now?
Well, I think PPE is probably still the number one thing, right? Overall, probably most people, probably minus the places that have been hit really hard, really early with this, are still seeing low volumes. At least that's what we're still seeing in the emergency department in general, right? It's a fascinating social experiment that's been proven now, right? For all of us going into emergency medicine, is if you're not really that sick, you probably don't have to come to the ER. So it's showing itself, right? All the people that don't want to get COVID that have minor issues are just staying at home. So the volumes are low. We're probably seeing more COVID positives coming in and sicker ones that are coming in. But I think resource-wise, it's still pretty much PPE. It's amazing how much community involvement has been happening, though, at least in the Lehigh Valley where we are, because, I feel like we get pizza every hour now in the emergency department. It's going to probably lead to an obesity trend in healthcare workers over the next year. Probably puts us at higher risk of dying from COVID if we get it, because we're all going to be fat and probably have hypertension and diabetes by the end of this. But at the same time, it's amazing how much community partnership has gone on to get local businesses and restaurants to donate food for healthcare workers and everything. It's been pretty awesome.
So we have one question is, what are some things that medical students continue to do to help advocate on a local, state, or federal level? They feel like the main things have been PPE and medical supplies. Is there anything else that people haven't thought of yet?
Yeah, I can jump on that. One of the so I agree, and kind of what I've seen in Chicago is that the overwhelming primary need is for PPE, just to be able to get through the day-to-day without risking exposure to yourself or the people around you. But as far as some of this advocacy work that students can help with, what we've done in Chicago is connected with some of the some community partners that already represent some of these more vulnerable populations, and just kind of helped amplify their voice in a sense. So there's a couple like Chicago-based organizations that advocate on behalf of like the homeless population, of low-income families, and we just set up a couple teams, and their role was to be kind of the liaison between our organization and that organization, and also to kind of just be extra hands, or really, while we're all kind of stuck staying at home, just be extra phone calls that could be made to, like, whether it's public officials, just increasing awareness of what's going on, or social media blasts, or retweets and that kind of thing. Just trying to increase the chatter around some of these issues that we can't directly impact, but we can make a lot of noise to get the attention of the people that can.
And I'll also say each state is so different from each other and their needs and their communities. So if your question is how to advocate on a local, state, federal level, the biggest thing to do is to connect to an organization like PACEP, but in a different state, and ask them how you can help, because it's hard to give kind of overarching advice other than PPEs and also kind of what Matt mentioned. But more specifically, I think if you reach out to them, their needs might be very different from, let's just say, Pennsylvania Lehigh Valley needs.
Did anybody else want to weigh in on that before we move to the next question? Okay, so I guess also somebody's interested in knowing more about this scribing and how that was set up, and how was it initiated by the hospital or by students, or how did they go about setting that up? I think that was that Shelby or Shannon? Sorry, was that Shannon? You were the one with the scribing? Okay, we can circle back to that. So also for PPE, what are contacts are you establishing to get donations or purchasing PPE? How are you finding organizations to reach out to?
So I can start with this one. So on the level of donations, we've been contacting anyone that you think would be having this. So this is anywhere from exterminators, nail salons, spas, roofers, construction workers, painters. A lot of places that sell garden supplies have them. There's a lot of people who are not working right now and are able to donate a lot of their supplies. In terms of purchasing PPE, and with stuff like that, a lot of that is just brute emails and calls. Like, I personally emailed like over 200 companies. With purchasing PPE, I think we've been working with like Chicago's Get Me PPE, and we've been working together with a lot of those groups to be able to vet and secure like reliable distributors. So a lot of the products that we've been purchasing, we've just been working together, and it's a lot of like brute force trying to find places that can that you can get from. And obviously there's a lot of shipping delays now, so that's also a big problem. But I think a lot of it is just finding reliable places that can donate to you, and finding reliable places to purchase from.
I'll also add to that. So I've actually been really active on social media through this whole process, using Twitter, Facebook, Instagram to find donors of PPE and find just sources that people know. I've had this morning somebody messaged me and said, oh, my brother worked for this company and he has this and this to donate. So just putting it out there that you're actually looking for these supplies, just see what you can get back. I've had tons of people message me, say, oh, I found this, or oh, I saw this. I saw somebody, a friend of a friend of a friend posted this. Like, you never know what you're gonna get. So I've actually been really successful through using social media platforms. So you could also try that.
Awesome. Brendan?
Actually, to bounce off of exactly what Shelby said, yeah, using Facebook or Twitter is like a good platform. I've gotten reached out to by like tattoo parlors and like just a bunch of like random auto body shops that are like, hey, I have these masks, you know, would a hospital be able to use them? And I'd be more than happy to just, you know, send a student to come out or myself go out and collect whatever you guys have to come back and bring it to the hospitals. So yeah, looking, you know, using Twitter and using Facebook is not only a great tool for, you know, being able to find masks and PPE, but also for, you know, recruiting as well and trying to get in touch with people, because in all honesty, the best way to find people is through Facebook, you know? So that's really how most of my initiative has been started, was simply by starting a Facebook group and saying, hey, you know, who wants to help and who's, you know, who wants to get out of the house to try to do something and make a difference, you know?
That's awesome. I think that really touches on our next question. For those of you who started your own groups, how did you get that started, and how did you recruit? How did you decide how to deploy and organize yourselves?
So for BU, it all started as just a Facebook post to kind of gather interest, and you could just fill out a Google Doc with an Excel spreadsheet, what your contact info is if you want to be put on the info list. And that kind of quickly exploded. We have a really active student body, and we decided it kind of needed to be more official and streamlined. So we got in contact first with our medical school deans, because they were really able to help us liaise with the hospital and get the right contacts there to see what they were open to having medical students do and whatnot. And they were extremely excited about the opportunity and like very receptive and really worked with us. I just want to put out there that we have all of our forms, all of our startup documents available to send to interested medical students if you're interested in starting up a similar program at your medical school. But mainly, you know, Google Forms and spreadsheets is kind of how it all started. And then we've created like an official website now where providers can sign up for their interests and students can sign up if they're interested in volunteering. And then we have sort of now a network of medical students who, you know, couldn't help volunteer in person. And so now they've decided to volunteer remotely, which would be like pairing medical students with providers.
Yeah, in Chicago, that's great, Shannon. We did almost a pretty identical situation for us. All the student leaders kind of connected with each other because, you know, the nature of student leadership, we've like interacted in the past for random things. So we were able to kind of connect that way. We also developed just a Google survey of, hey, you know, who's interested, and there were a couple little nuanced questions about skills and past experience and you know, interests and stuff like that. And so the way that we've kind of built our infrastructure is we have our executive strategy team that, you know, does the executive kind of big picture, make sure that all the moving parts are moving cohesively in the same direction. And then we have 3 what we call like action or like external branches. That's the community outreach and vulnerable population advocacy, the PPE allocation and distribution, and then just healthcare worker support. So we have individual student leaders that are on each of those individual teams that kind of field and organize the projects related to those 3 topics. And then we've got a series of kind of internal infrastructure teams as well. So we have like a data and IT team. We've got a fundraising team. We've got a public relations team. We're putting together an education and wellness team, which I think was a really cool idea by one of my colleagues, to kind of piece together a lot of the literature that's being published so rapidly and some of the fragmented student education resources that are out there, and just kind of, you know, use one centralized kind of location to access all of those. But that's kind of how we've built it in Chicago. We've got those 3 kind of external facing branches and avenues, and then we've got a couple infrastructure teams just to make sure that everything, you know, keeps moving.
Yeah, I mean, same with what Matt and Shannon said. We also basically got our head start on social media. And we've also created kind of like what Matt is saying, an education packet that we've sent to schools in Maine, Pittsburgh, Florida, and there's another couple other schools that I'm forgetting. So if any other schools are interested in starting up like a similar organization, we're more than willing to help you guys and hook you up with all of our distributors. I think ultimately, like, I don't think any of us will be satisfied until every healthcare professional has, appropriate PPE. So that doesn't mean one mask for 1 week. That means one mask for an appropriate amount of hours. So I think, we're all doing really amazing things. We obviously have a lot of work to do, but it's like really awesome to see how many students want to get involved. I think it really speaks to the future of our healthcare system. It's going to be really amazing.
Awesome. So quick question for, I guess, Jeff is, do you know if the volunteer EMTs that you guys are looking for need to be certified in the state of Delaware, New Jersey, or are states granting reciprocity for EMS?
Yeah. So the spot that needs the volunteers right now, Delaware is all paid, so they're all set. But it's actually it's a squad on the shore, New Jersey. But the New Jersey OEMS actually relaxed the restrictions on needing a Jersey certification. So it actually just needs to be a national. But even if you're not a national registry, they'll take a card from another state during this. So all are welcome. They're actually to the point that they relaxed the regs on needing 2 EMTs on a truck to the point that you can actually have a non-certified driver. So if anyone still wants to volunteer but doesn't have a certification, we can teach you to drive the beeping cart. It's fun.
Interesting. So for Doctors Quinn and Lauber, are medical students currently incorporated at Lehigh Valley? And I guess to bounce off that, if they were able to be incorporated, what kind of role would you see for them?
At this time, they are not clinically involved, just to protect our medical students. But I think I'm definitely, and Dr. Quinn, I'm sure, are both very interested in trying to use our resources, such as medical students, NP students in our community, to get involved in other community outreach programs. And that's kind of what I mentioned when I started this conversation as well, is that I'm looking to learn from you guys as much as, we're looking to kind of talk to you guys as well. So at this time, clinically, they're not working in the hospital.
So for medical students, particularly and organizers, what are some of the biggest obstacles that you came across in creating these, and how did you figure out workarounds for it?
I can start us off with that if you want. One of the biggest things that I've come across so far is actually finding a way to spread the information and spread this program out to a lot of the docs in our area. I'm finding that a lot of people in the healthcare field and a lot of the elderly aren't really, they're too busy, or they're not well versed in social media to be able to find us, more or less. So it's become a lot of calling people and trying to get in touch with people in person or over the phone, and just trying to say, hey, we have this program and this is what we're interested in doing, and this is the group that we're interested in helping. Do you know anyone who needs help? So I guess just finding people and finding people to help and finding people who need help has been the biggest obstacle so far, especially in our area.
Yeah, I'll definitely second what Brandon just said. I've definitely been using my contacts that I've met at conferences. So basically every doc that lives in New York that I've gotten their email from some conference, I've emailed them about this project. And I'm just like, hey, remember me? But it's very difficult, and a lot of them are really busy and they're not checking their emails as often as they normally would. Some of it might go to their junk folder or whatever. So it's actually been pretty hard to get a hold of these doctors. So again, just going through any channels that you can possibly use. A lot of EM docs especially are on Twitter. So just like blasting it on Twitter, having other medical students blast it on Twitter or Instagram or whatever. But that's definitely been a challenge too, is communication over here.
I think we haven't exactly had that. Oh, sorry. We haven't really had that challenge. I think that's mainly because we were able to liaise pretty quickly with our administration and get them on board with us, and they sort of were able to get the right contacts at the hospital, and kind of email blast their employees about the program. So if that's an idea on how people can really get that word out there to their providers, we did only start because the demand was so high at Boston Medical. We have only kept our volunteering to that hospital specifically for now. But one, I think, unanticipated, I guess, challenge that we've come across is just ensuring safety of the volunteers, especially with childcare. Like, you need to be very specific that these the students volunteering for childcare have to be self-quarantining outside of outside of providing childcare really strictly, because the provider might be coming in contact with COVID and then being in the house. You just need to make sure that students interested in volunteering in that aspect are really committed to self-quarantining. And then we've also used our volunteer force for other smaller volunteer opportunities. We'll just kind of send out a blast like, oh, here's this, they need a couple of volunteers for this project and whatnot. And we have found that if you have an organization, we've had organizations come to us to ask for volunteers, and we found in one case they promised us and assured us that they would follow social distancing guidelines when using our volunteers, and then our volunteers kind of let us know that that was not the case, and that's certainly not something that we wanted to be advertising to our volunteers and putting them at potential risk. But we found that the volunteer organization was really, so we had to suspend volunteering with them at the moment, but we found that they were really open to writing guidelines with us to make sure that our volunteers are safe. So just keeping that at the top of your mind when you're taking on these opportunities.
Yeah, in Chicago, I think that the high volume of medical students and medical schools in the area is pretty unique around the country. But I do think it applies to Pennsylvania and the Philadelphia area. We ran into kind of the I guess the biggest issue we had was kind of integrating duplicative efforts that had already had 4 or 5 days of independent productivity, trying to kind of unite them under one umbrella of leadership. Took a couple days, probably longer than you'd think, or than it probably should have. We kind of ran into what is it's overwhelming in all the best ways, but we had so many competent and qualified leaders that just think differently. Anybody's idea could have worked, and we just had to kind of have a pretty frank conversation with our leadership team to be like, hey guys, a lot of this is arbitrary, but it will still work. We just need to kind of settle on a kind of a more internal leadership structure so that we can make sure that all these projects and independent projects that we've built can be unified and moving forward in the same direction. So the biggest obstacle that we kind of encountered was just unifying. It would have been way easier if we had started together from the very beginning. But after we had that talk about, hey, this is not institutionally affiliated with any of the 7 of us or with any of our community partners. This is just a bunch of people who happen to be medical students, but also have all these other robust skills and experiences coming together under a more independent and united organization. We were able to kind of get over that hump and get moving.
Awesome. So just to circle back to a question from earlier, Shannon, can you talk about a bit about the scribing and how that has been set up and initiated?
Yeah, so I have not been huge on the scribing team, but I can put you in contact with our medical student, because that's headed by a 4th-year medical student. It's only open to M3 and M4s who have clinical experience. So I can give you their contact info. I talked to them a little bit about before we met, and they're really open to speaking to anyone interested in starting a similar program. We have not instituted the scribing program in our hospital yet because we haven't been hit super hard yet, and there hasn't been a need, but they have been developing it if the need arises. So we haven't actually started it yet. But I can, I don't know the specifics of how that's being run, but I can give you the contact info of the medical student who is heading it.
Awesome, thank you. So we have another question, and this is more for Drs. Laubert and Quinn. And this is one of the more controversial issues we're facing right now is how do you feel about the early graduations of M4s and starting residency early? Is that something that is going to be helpful or not necessarily right
now? Well, I think the AAMC just, what was it, yesterday or the day before, released that except for extraordinary circumstances that they're not going to basically grant anyone to graduate early, which is probably the right thing, right? Is at the outset of this, to be honest with you, is we weren't even letting any of our residents see any of the possible COVID patients because, with, the way that the GME works is all the attendings have to see the patients anyway that the residents see. So our network, at least, and this probably varied across the country, at least when this started, right, is the attendings were the only ones seeing the possible COVID patients. Now, over the last week or two, that's turned into now everyone we presume has COVID, right? So I think we've basically, with all our residents, have said, we just have to start seeing the patients because then we're just not utilizing the residents in the right way. So I think the problem with clinically having medical students graduate to become, PGY1s is a couple things, right? Is especially Priya can probably speak to this, so she's the closest to becoming a brand new intern, but there is the learning curve, just learning how to do things within your institution you're going to match at and work in is massive enough, right? And then we're throwing you into the gauntlet of having to see the sickest of the sickest patients where they're recommending, intubation should only be done by the most senior airway manager, when line should only be done by the most experienced person. It's a little tough for you guys to step into that role, I would say. But I think the one thing that really all of you should be doing is paying attention to how this is all happening, right? From a global standpoint, because this is going to be something that in 20 or 30 years, when all of you are in my spot or in the attending spots now, are going to have to look back on this and show the medical students that are working with you or the residents your experience during this, right? Because we're going to get pandemics, but this is probably a once in a generational pandemic, right? You're going to have to reflect on this and use what you know. So I would be sponges at this point and really try to absorb not only what everyone's doing on the outside, but also clinically is really have some sort of a mentor that's working on the front line so that you can kind of just ask questions to absorb their knowledge and their experience so that you can use it on the flip side of this when this happens again, which I'm sure it will at some point in your lives.
Yeah, thanks, Dr. Quinn. That reminded me of something that one of my mentors had mentioned to me as well, is that for medical students right now, it's kind of an indirect thing, but the residencies that you're thinking of applying to, kind of figure out what they're doing and how they're treating their residents and attendings during this time, because I'm sure it varies across the country, and that'll give you an insight. Whether you want to ask about it on the interview trail or just make some phone calls right now, it'll give you kind of an insight to the culture and community in that program that you might not get, just from browsing the website.
I echo a lot of feelings that Dr. Quinn just mentioned. I think, and also, by the way, he spoke, going to be a brand new attending, not intern, Dr. Quinn, PGY3. But anyways, so I think what I was going to say was, so when you start off as a PGY1, there's such a huge learning curve, and it actually bogs down the system quite a bit. I think I understand the sentiment of wanting some extra hands on deck, but you also want to be careful not to get in the way of patient care and standard of care. And that's a huge thing to learn. It takes a lot of investment. So I think it's hard to just put a brand new, freshly graduated medical student intern and just expect them to manage really sick patients. For instance, yesterday we had someone that needed a line, needed to be intubated, had emergent blood. I mean, all of those things, and it functioned really well because they were in a high acuity pod with the senior resident, and everything flowed smoothly. And I can tell you, just a few years ago, that would have scared, you know, any PGY1, but it just because of what you're seeing and how things are functioning and how fast-paced things are. So I think I understand the sentiment behind it, but I would strongly caution against it for the reasons that I mentioned.
I mean, the educator in me tells me that this is a great opportunity, right, for all of you to learn what's going on and how we're doing this. But I think the infection control side of things for most networks is preventing that educational opportunity from happening. And probably, I think if you look at this more globally, it's probably the right thing to do, right? As much as you'd all love to be in there handling those really sick patients, I think we do have to understand that we don't want to expose more people than we need to potentially really sick people. And I get that part of it, right? So I think it's tough. It's tough to be in your guys' seat right now. All of you, student-wise, are just sitting on the sideline waiting for this to kind of blow by so you can get back in the clinical arena. And it's tough. I don't know what I would do if I was in your position, but I think I'm not nearly as good as all you guys are, because I think what you're doing on the sidelines is amazing. I think a lot of students would just feel like this is a great vacation to have and sit inside and self-quarantine and Netflix themselves the entire day. And you're all out doing stuff, which is a great start, and it's a good future. Like someone said before, is I think the fact that you guys are being so proactive is a super positive thing that's gonna, at the end of the day, really make you great candidates to kind of move up the ladder academically in programs that you're at, because you're gonna have a lot of experience other people aren't. If you're on this call and you're saying what you're already doing, this is a huge step forward. I mean, so I think someone kind of sort of mentioned it, that this is going to be a big question during interviews. I'm sure, it's going to be, what did you do during the pandemic? How did you try to help, humanity as a whole? If you weren't working clinically, what did you do those couple months in March, April, May, while you were not able to work clinically? So I think all of you are really showing that you're going to have a step up on a lot of people when it comes to interview season too, no matter what specialty you're going into. It's great that you're being active, which is great.
I can speak that even in EMS right now, we are shielding our trainees from being on the ambulance with COVID patients. So we're having our trainees sometimes in quarters helping with organizing equipment, and we're getting a lot of PPE donations as well that we have to sort through. But as far as clinically, it's mostly just senior staff that's actually working on the ambulances right now for us. We're fortunate to have that much depth in our organization, which is not certainly true of everywhere, especially when you get it out into more rural areas, which rely heavily on volunteer staffing. So another question that was asked, which is a great question, is that for people who are organizing PPE drives and donating the PPE, how do you find who to donate? Because I guess this person's from like a small town in the middle of nowhere that might not have a lot of cases. Are you trying to send PPE to the areas that are hardest hit, or how are you sort of assessing the needs and who needs to get what from your organization?
Shelby, you go first.
Okay. So we have a Google form that we're actually sending out to each individual ED in the New York City area. We're starting with New York City, and then we're trying to eventually branch out to the more rural parts of New York and upstate and everything. But New York City, of course, needs the most right now. So we basically have a task force of students who are calling each of these EDs and trying to track down a contact person for each ED. And once we find that person, we email them this Google form. They fill it out with their contact info, and they say specifically, these are the supplies that we need. We need masks, we need gowns, etc. And they just kind of check off the boxes and say what they need and how many they expect to need over the next couple weeks or so. And we just kind of prioritize that way based on their feedback of what they need.
Yeah, so ours is pretty similar with we started in Philadelphia and we've branched out now to a lot of the surrounding county hospitals. Since like, for example, Montgomery County is a huge hotspot in Pennsylvania. So we've done a very similar thing. We have each hospital has a student volunteer contact and then a contact at the hospital. The great thing is, since most of us, are in rotations, you probably know at least one nurse or one resident or one attending at every single hospital, so they can kind of like get you in there, and then you can talk to them, or sometimes they like send us up the ladder. We can talk to people who are higher, either in like the supply chain or logistics part of dealing with the hospital supplies, which is obviously that's a lot that's a lot more like better of a resource to be utilizing. And I think it's great. I know I don't want to speak on Chicago's end, but I know one of my best friends is helping with the Chicago team, and a day or two ago they were approached by a hospital that was like an hour outside of Chicago saying that they had absolutely zero PPE and they were dealing with COVID patients. And I know that Chicago's also been doing an amazing job with getting it out to surrounding areas.
Awesome, thanks you. And so another question more specifically addressed towards Matt is, what exactly are you doing in addressing the needs of vulnerable populations during this time?
Sure. So our vulnerable populations team, most of that leadership team are community organizers that are like liaisons from other community like organizations that are kind of directing our student volunteers as to the needs of their organization. So for example, we have some of the organizations we're working with are like the Midwestern Workers Association that is, it kind of serves like a union function for some low income and like hourly wage earners in the Chicago area, just to organize like some food drives and some resources that are specific to their needs. There have been a lot of like phone calls organized and like email, I guess, support type of projects to kind of inundate the city and state officials just to kind of raise awareness, where they were designing like one-pager fact sheets about how all of this affected individual populations, like I had mentioned, the homeless population, the low-income families, the incarcerated populations. We also made contact with some of the larger public schools, public high schools in the area, just to see if there was any, just to see what kind of virtual tutoring we could offer, and if there was like a program that we could set up to kind of help ease the burden of all the quarantine students not having access to their schoolwork and things like that. So I hope that answers your question. It's been a lot of community partnership where we can provide more of a hands-on, like extra amplification of what those community experts identify as the specific needs.
We've been able to partner with a couple of local, like we partnered with the Red Cross Food Bank and had students there volunteering to assemble food boxes to send out to different homeless populations at Boston Medical. We had students partner with About Fresh, which is an organization that brings food to people who are underserved. And then specifically, we have students that are volunteering on the box truck, basically dropping off food packages at homes that are in need, so that they don't have to, there's no contact like with the student in the home. They just drop the food box at the front door and then get back on the truck. But those are a couple of ways we've been able to volunteer with more underrepresented populations.
Awesome. So another great question for especially the medical student groups, what are you doing to protect your volunteers? Or is there just a general understanding of that there is a risk associated with going out right now?
Yeah, so one of the benefits we have in Chicago is just the volume of responses that we've had. It is just kind of an understanding in the survey form that they fill out. They can kind of list what type of work they're interested in helping with, so that they are only emailed opportunities that kind of align with what their level of comfort is. But there's during our onboarding process, there's kind of a like an explanation that like by no means do we obligate you to do anything you're not comfortable with. We have kind of the blessing of an overwhelming number of individual volunteers, where any individual project might only need like between 3, 5, 10 people. It'll get done, and don't feel like you have to be the one to jump in if you're not comfortable with whatever that task is.
For the Philly initiative, the way that we've been trying to also do no contact. So whenever we do PPE distribution and drop-offs, we'll put it on the porch and have, no contact. And then the person who's getting them, is gonna, whichever we try to give it to the doctor's house or try to do it at the hospital. And if we do it at the hospital, we try to do as limited contact as possible. If they do it at their house, they'll do the same thing and try to drop it off at their house on their porch with no contact as well. So we're trying to just limit contact and, asymptomatically spreading things as, efficiently as possible.
Yeah, similar for us, we've had, we send out a match email to each volunteer student once we match them with a provider. And in that email, we have like a note on social distancing and safety, and especially with the childcare, making sure that to self-quarantine and you're committed to self-quarantine when not helping out with childcare. And then again, as I had mentioned earlier, we had sort of an issue with sending our volunteers to a site that wasn't really adhering to social distancing. And again, we immediately suspended volunteering with them and, sent an email to students just to reiterate that if there is something and you're not feeling comfortable or safe in a situation, you do not have to stay and you can leave at any time. And this is completely voluntary. And then again, after that, working with that organization to rewrite a safety plan for our students.
Awesome. I do want to jump in. There was one question that I saw earlier about how you can jump in and get involved straight off of the call. I do think that kind of taking the time to kind of send feelers out and see if there's anything happening through your institution that you can plug into. Absolutely do that first, but don't be surprised if the answer is no, we're not doing anything right now, and having to build your own. Because I know my school specifically does not have any formal institutional projects going on, because very understandably they're focused on the medical education side. They want to make sure our graduates have all their grad requirements done. They want to make sure everybody from the M1s to the M3s have as much academic support and are not interrupted in their educational training as much as possible, and they just haven't had the time to set up some of these more external initiatives.
Awesome. So we're kind of at our time limit right now, and I want to thank all of our panelists for attending and providing such awesome information. You guys are all doing such an amazing, incredible job. And it gives me a little imposter syndrome just to be on the same panel with you guys. So thank you so much, and this is great. Just remember that all the panelists' information was sent out with their contacts. So if you have any more questions, feel free to reach out to them directly. I'm sure that, clearly everybody would love to talk more and wants to get other people involved in this effort. And, it's constantly going to be evolving, and, different areas will have different needs. So definitely reach out early if you have some ideas you want to get involved with. Thank you everyone so much for attending. And also this is being recorded. So if you want to rewatch or you want to share this with other people, this will be emailed out to you as well. So thank you so much to everybody. Dr. Quindler-Labber, do you have any final thoughts you want to leave us with?
You guys are doing a great job. I echo Alex's sentiments. Thank you for being involved, even though it's not clinically. And I really honestly am looking forward to working with everybody over the next year. I think this is a great start. I'm more than willing and happy to answer any questions, serve as a mentor. Just please email me, call me. All my info is on the sheet. And I'm just honestly really happy that you guys all are involved in this way. It's going to really, in the end of the day, really benefit everybody in the whole country, honestly, specifically in the state. But what you're doing is extraordinary.
Yeah, absolutely. I'm very impressed, and I'm so thankful to be part of this panel, and I'm looking forward to working with you guys in the future in emergency medicine. So thank you.
All right, awesome. Thank you so much, everybody. Have a wonderful day, and everybody stay safe.
Good one, guys.